Well, this is the 12th session of Polytrauma Pathology station in MRCS. Okay, as you see, the station is long. It will not be that long. If you know the answers in the exam, you can answer fast, and sometimes you have spare time also. But we are trying to explain here, so the job in the exam will be easy for you. Okay. So in this section here, we are going to discuss some microbiology questions that will show in this station with the polytrauma station. Okay, and they will ask you actually in the beginning. They will ask you some general questions. For example, the first question here will be if you have an infected implant. Okay, if infected implant, what are you going to do? Definitely you are going to remove it. Okay, so they will ask you, why are you going to remove it? And you have to know or to tell that because it is a septic focus. Okay, and the keyword here is septic focus. Okay, they want to get this answer. For this answer, I think there are 2 marks. So an infected implant should be removed because it will become a septic focus. This is the first question. Well, let us go to another question here. What is the first test that you are going to do? The first test, okay, that you are going to do if you have an infected wound or you have an infected implant or whatever. Okay, you are going to do only one test. It is wound swab. Okay, for culture and sensitivity. Fine. You are going to do a wound swab for culture and send it for culture and sensitivity. This is your test in this case here. If you have a septic focus or a septic implant or an infected wound or whatever. Okay. Well, now we will go to the third question. It's a pretty difficult question, and it is, they will ask you, what do you know about PVL Staph aureus? Okay, and this is not an easy question. So first of all, you want to know what is the meaning of PVL. PVL means Panton. And this is P. V means Valentine. Okay, and this L means leukocidin. Okay, I think there is no C here, as I remember. Anyway, it doesn't matter. So it is an abbreviation for this. And what is this? This is actually a name, this Panton Valentine leukocidin. Actually, it is a very potent cytotoxin. Okay. And as we told before in another station, that cytotoxins are stronger than enterotoxins and other types of toxins. So what does this cytotoxin do, this Panton Valentine leukocidin? It is a pore-forming cytotoxin. It forms pores, okay, at the walls of the cells. It punctures the cells, okay, by making pores through its wall, this Panton Valentine leukocidin. And that is why this sort of bacteria or this strain is so potent, it is so dangerous. Okay, and unfortunately the majority of the community associated MRSAs are actually PVL Staph aureus. Okay, so this is the answer for what is this? What is PVL Staph aureus? Well, they will tell you ask you in details, and they are making this a separate question usually, or they can contain it within the answer which you told before. So you told that it is a pore-forming cytotoxin. This PVL, it's a pore-forming cytotoxin, okay, as we mentioned before. Well, what does it do? We told that it makes spores at the membranes of the infected cell. So, what is the result of that? Why this cytotoxin or this type of bacteria is so dangerous? It is so dangerous because it causes extensive necrosis. It causes necrotic lesions and extensive necrosis. Okay, and one of the famous results of the infection by this sort of strain or bacteria is something called necrotic hemorrhagic pneumonia. It is a fatal thing. Okay, necrotic hemorrhagic double R here, hemorrhagic pneumonia. Okay, and this is really dangerous. Necrotic hemorrhagic pneumonia. Remember this in your mind. Okay, if you say it, you will be professional, and they may ask you about for an example here. Okay, so they will focus in this PVL. It will not show in other stations. So if you are lucky and your station is polytrauma, so it will be embedded inside there. Okay. Well, I think that we will have only one session here, and this station will end. So I wish you good luck.